Today, we're going to share with you an overview of the process of empirically informing your treatment plans.
In this program,
Today, we're going to share with you an overview of the process of empirically informing your treatment plans.
we'll begin with a brief history of the movement to identify empirically supported psychological treatments. We'll discuss how this movement fits within the larger context of providing an evidence-based practice. We'll discuss advantages to using empirically supported treatments, as well as some of their limitations. Lastly, we'll outline the essential elements of the treatment planning process and show how it can be informed with goals, objectives, and interventions consistent with those of empirically supported treatments.
The use of evidence-based practice is becoming critically important to the mental health community. This program is meant to increase your understanding of how the work on empirically supported psychological treatments can be incorporated into your treatment.
Another criticism of the effort to identify EST charges that it downplays the importance of other factors involved in the delivery of psychotherapy, some of which have been shown to contribute to therapeutic outcome. Examples include factors related to the client, the therapist, the relationship, and the like. Of course, EST review groups acknowledge that their efforts are only part of the equation in determining therapeutic outcome. You can see that in this statement by the Division 12 site that disseminates ESTs. It states that the client, the therapist, and the therapeutic relationship are among factors that also contribute to effective treatment. In providing information on research-supported psychological treatments, we do not intend to devalue the importance of these other factors.
Didn't the Psychotherapy Division of APA first highlight this issue?
Yes, they did. Division 29 took up the effort to identify empirically supported relationship variables, or ESRs, and you can find references to that research in your workbook.
I think it's fair to say that although early discussions of these issues were the topic of sometimes polarizing debate, recent attempts have been made to look at how content, process, and other factors can be brought into an evidence-based practice that reflects their contributions.
Yes, one example of the approach you describe, Art, is the recent movement to identify principles of therapeutic change that may be reflected in identified ESTs and ESRs.
This type of integration is what's reflected in APA's definition of evidence-based practice.
Exactly, which, as we discussed earlier, states that evidence-based practice is the integration of the best available research with clinical expertise in the context of patient characteristics, culture, and preferences.
So, how can a clinician arrive at an evidence-based practice?
Good question.